to make decisions. So come on in. So we're connecting the dots back to you. Because you all have it in here, it's just being able to articulate it. It's your everyday, you do it all the time. So I'm just gonna help you through it today. So first I'm gonna talk about, I'm sure you're all familiar with our structure for creating decisions, right? It's our collaborative governance model. So I know we have our collaborative governance steering committee, which oversees our councils, and then we have our other bigger councils, but I know most of you are probably familiar with our clinical practice council and how all the different departments and unit practice councils feed into that. And so one of our examples of evidence-based practice and promoting patient outcomes was through our, I'm sure you're familiar with the I Pass the Baton process. And so that came from through Clinical Practice Council and out to the different units, and each unit embraced it and created and modified the tool to make it suit their unit. And we'll talk about that in a little bit. So I'm going to bring you over here. So another piece that we're committed to is professional engagement. So what professional nursing organization do you belong to? Well, as you can see, many of your colleagues belong to different professional organizations, which is great. And there's a link. There's a link between professional engagement and nursing organizations and patient outcomes. So I'd love for you to put a dot on it, put your national organization and your name on to show your colleagues as a whole how many of you are involved in national organizations. So I'm going to bring you to our story. We have an example that we submitted a story to the Magnet Group on Occlusion Management in Central Lines. And basically what this is our vascular access team. And our vascular access team, what they did was they engaged their national organizations on guidelines and for best evidence-based practice. And they were able to incorporate it into our own guidelines to help improve our occlusion rates of our central lines. So that's an example of a story that you can speak to when they ask about examples of being part of professional nursing organizations and impacting patient outcomes. You can talk about our occlusion of central lines. So I'm going to bring you over here. We're talking about our commitment to community involvement. So how many of you have been part of nursing, have worked with nursing students, right? So as you can see, you have many of your colleagues, and I'm sure you too have been involved with working with nursing students. So that's one way you can talk about community involvement. So here's some of our data on our nursing student placements. These are some of the schools that we have supported. And as you can see, San Diego State is one of our bigger nursing programs that we have supported. And you look at our nurse placement degrees, most of our nurses are in the baccalaureate program, but we do help support our master's programs and our advanced practice nursing programs as well. So I'd love for you to come up here and put your name up here. Not only do we support our nurses in the community within the hospital, but nurses are also doing it outside of the hospital. So what community activities have you participated in? Well, there's the Heart Walk, there's the stroke screening, and maybe you've been part of Shark Lens, a Helping Hand. So again, I'd love for you to come up here and put down, we've had nurses here who did Here's to the Heroes, Leukemia Lymphoma Walk. So you've all done great things. So again, it's all in your head. Just be able to express it when surveyors come up to you and ask you about your community involvement. You've done it inside the hospital, outside the hospital. So I'm going to bring you over here. So what we've talked about already, this was our I Pass the Baton process, right? We've talked about how each of the different unit practice councils took it to their units. We have a standardized template, and then each unit was able to make it more specific to their unit to meet the patient needs. And a lot of this has to do with standardizing and organizing communication, because if you look at Joint Commission data and sentinel event data, communication is a key piece of patient injury. And so to promote patient safety was standardizing that communication. Down here, we have an example of the SICU's journey for utilizing and developing their I Pass the Baton handoff tool. And as we also talk about professional engagement, and this is the Case Management and Social Work Unit Practice Councils. So they too have put together their council so that staff can help be part of the structural way of us making decisions. And I don't know if you realize this, but Charlotte has 20 plus UPCs, or Unit Practice Councils. And so that is just our way of being able to create decisions to make better practice guidelines for our patients and improve our outcomes. So I'm going to turn you over here. And this is our example of how we provide, a great example of how we provide patient or staff education, and this is our STOP program. And so basically, just like today, we had a different unit or different stations, and all the units and all the staff came through, and we're taught on the highlights of areas where they identified were opportunities for improvement for reducing patient falls. And as if you notice, I'm going to come down here as the patient outcome. So as you can see, the patient falls have decreased tremendously and been able to maintain those gains. And so one of the things you can think about, again, it's your everyday, is you're in the room, you have a surveyor with you, you got your stop fall risk sign. You can think, oh, what a great example of professional education that has been given by Sharp to help promote patient outcomes. All right, so we're going to move you over here. So this is our commitment to professional development. So how many of you are certified, right? Do you have your nursing certification here? Some examples of the different certifications that are available. And so if you look here, this is our goals to demonstrate an incremental increase of nurse certification 0.5% per year. And you can see from 2010 to 2011, we've actually increased from 7%. So as you know, with increased certification, there's increased quality of care to increase patient outcomes. In addition, I'm going to move you over to here just real quickly. This is our formal education that we also support. I know with both certification and formal education, we support it in many ways through reimbursement, education dollars, scheduling, support by our managers. So again, if you have your certification or if you have or you're in school, we'd love to have you put your dot on here so you can see how involved we all are. I'm going to turn you around. And this is a story that we submitted to Magnet, and this is an example of nurses being involved in committees or task force to help promote patient outcomes. And this has to do with our meal dose insulin, right? Getting our blood sugar, and then within 30 minutes, getting our insulin, our meal dose insulin to our patients. And so this is something we do every day, right? So when they ask about examples of involvement in committees to promote patient outcomes, just think about your diabetic patient or that blood sugar you did and why you're so concerned on getting that insulin within 30 minutes, right? Because we want to keep the blood sugars between 70 and 180. It's for our perfect diabetic days. So I want you to come over here. This is my favorite part of the board. This is our commitment to recognition of nursing. So we do that in many ways. We do that with Nurse of the Year, Employee of the Month. Ways we can do it also is through e-cards, WOWs, we have our Beyond Excellence tokens, and we have our Guardian Angel program. And so what we've done here is these are your colleagues who everybody who's come through this station has either named a unit or a person and what they appreciate about them. And so that's another way that we are committed to recognizing our nurses.